Joining us this morning, our friends from Titusville Area Hospital. We have Kelly Clark. She's the Marketing and Communications Specialist. She joins us this morning. Good morning, Kelly. How are you?
I'm good. How are you doing today, Luke?
I'm great, thank you. And you brought in a very special guest.
Very special guest. This is Dr. Gates. He joins us from Orthopedic Associates of Meadville. He is going to be our orthopedic surgeon here in Titusville, which is so very exciting. So welcome. We're so pleased to have you.
Yeah, welcome to the community.
Thank you.
Good to see you. So tell us a little bit about yourself.
Yeah, certainly. So I grew up in the Pittsburgh area in the South Hills. Did all my training at the University of Pittsburgh Medical School in Orthopedic Surgery. Most recently, I worked in upstate New York near Syracuse, and happy to be back in Pennsylvania to serve the people here.
That's wonderful. What stage in life did you know this is the direction you wanted to go?
I knew early when I was in high school. I had played sports in high school, had a knee injury. Myself was a patient of an orthopedic surgeon, had a great experience with it, and thought, wow, this is to be able to do this every day for people, to really have a positive impact on their lives. I was attracted to orthopedics also because it's one of the few parts of medicine where patients get better. They come to you with a problem. We fix that problem, and off they go, usually to do great things. In the case of joint replacement is a great example of that. Other parts of medicine is sort of delaying or handling the inevitable. But orthopedics is just not like that, and I really like that part of it.
What sports did you play?
I played basketball and football.
Did you?
Yeah.
What was your favorite?
I stuck with basketball longer. I had a bad concussion playing football. Even before all the traumatic head injuries things, I took a knee myself on football, but I played basketball all the way through. It was fun. It was great memories, great times. Nothing else like it.
Well, so you've been in that position, and I'm sure you've seen patients who've come in, young patients who said, Doc, I want to play in college, or I have the ability to move on. Is this going to be an injury that, am I done playing football or basketball or high school or baseball? Am I done forever, or can I heal from this and move on? I'm sure you've had those conversations with folks.
Yeah, definitely. And outside of head injuries and concussions, which is its own animal, most of the arm and leg injuries, people come back and do fine. In fact, in the case of Tommy John surgery, which is elbow surgery in a pitcher, they actually come back better. They actually can throw.
That's incredible.
Yeah. But, it's a nice part of orthopedics. Athletes get better and we get them back on the field.
How many years ago would that have been maybe a retirement sentence for a baseball player?
Yeah, exactly. So orthopedics is a field that's advancing. There's a lot of interest in research going in. So it's another thing I talk to patients about is sometimes they're thinking about surgery but not quite ready. And we talk about technology. Even the things I'm doing now, I wasn't doing a lot of these things 10 years ago. So the field does evolve.
That's incredible. And I think that conversation came up even last year with Ben Roethlisberger. It's like, well, he's going to have this major surgery, right? He's never going to be able to, well, I mean, you could question whether he actually threw the ball well last year or not. But the fact that he was out there throwing the ball and you're just going, wow, this is incredible. It's amazing how technology has changed and how advances in your field has changed over the years.
Yeah, no, it is, and we're all the benefits of that.
That's wonderful. Kelly, how exciting is it to offer the services here in Titusville?
It is really great. We definitely have a need here in Titusville. A lot of appointments for patients going back and forth, and we'd like to keep everybody here close to home and offer those services. I know, we always try to bring specialty services in, so when we were able to bring him in, we were very excited.
So, in terms of folks maybe needing those services now, do they call the hospital for those appointments?
Yep. Yes, he's currently taking appointments. I just referred a friend, and he got right in. He's seeing you today, actually. So you can call the office and make an appointment. The number is 827-9770, or just call the main line and ask to be put in touch with physician services. His office is right on the first floor with the other specialty services in our rural health clinic, so it's very convenient. And like I said, he's putting in a lot of time here at Titusville. I know we share a lot of doctors with Meadville, but fortunately, he's mostly ours, so that's great. We're very excited to have him.
That's wonderful. Well, Dr. Gates, outside of athletes, and we're coming into the fall sports season, so I'm sure it's going to be pretty hectic, but describe some of the other patients that you may see.
Yeah, definitely. So, as any orthopedic surgeon, take care of a lot of fractures that come through the emergency room. Hip, wrist, and ankle fractures are the most common. I see a lot of carpal tunnel symptoms and a lot of trigger finger. Those are common ailments I treat. Also do a lot of knee replacements, and I'm happy to bring conformis, total knee arthroplasty to the community.
Knee replacements, that's another one where the technology and the procedures have just vastly improved, and the success for those is just incredible.
It is incredible. If you look at all fields of surgery, cardiothoracic surgery, general surgery, plastic surgery, orthopedic surgery, and all the procedures that get done, from lung replacements to coronary artery bypass surgeries to total knee replacements, the data that supports the best outcomes is on total knee replacements. So
Wow.
in terms of positive impact on quality of life, and that's the kind of value that those joint surgeries deliver. And it is an enormous need because it's a population in the U.S. that's getting a little bit older, that's retiring a little bit sooner, that's wanting to stay active longer, that's less and less accepting of limitations. And so putting all those together, you have a big demand for total joint replacements. And yeah, so that's going to be an important part of what I do here to serve the community.
When somebody says, and maybe you've heard this, I've got so much pain there, but a friend of mine had knee replacement 20 years ago, and they still kind of have maybe some issues. I mean, things have totally changed in 20 years, haven't they?
Things have changed in 20 years. They have. I will say, though, I have this conversation a lot with people. We talk about people who want to know more about a knee but aren't sure what to do. What do I think? And I tell them this is one part of medicine where the patient's in the driver's seat. Orthopedics really is an elective surgery. So I do not look at an x-ray, see bone on bone, and tell them, you need a knee. I sit down and listen to them, because many people have bone on bone knee arthritis, but they're getting around pretty good and they're functioning well. And I look at surgery like going to war. It's a good thing, but it's serious, and you should do it only when you need to. And so I make sure patients are ready. When they are ready, they do wonderfully. They're very happy. The outcomes are high 90% in terms of good outcomes. But part of that is a mindset beforehand, making sure that they're ready, and I explore that with patients on a daily basis.
What's your favorite part of what you do?
Yeah, I mean, my favorite parts are the follow-up after the surgeries, when the problem's been fixed. And I call it graduation day, and I tell them I hope to never see them again in a good way. But
My wife says that to me, but
no, it's nice to see people get better. I mean, it's generally good people. This is one of the things that attracted me to a smaller community like Titusville's ability to have an impact on people. I did spend time practicing in Pittsburgh after I finished training there, but it didn't fit me well. I really didn't feel needed. I didn't feel like I was serving any great need. Pittsburgh is full of orthopedic surgeons. Where I was in upstate New York was similar to Titusville. It was an area of need. If I'm not there, people have to travel for their care. So it means a lot to me to be able to keep people here, deliver, use all the energy and effort I put into training, and to use that now to help the people have good care here. That means a lot to me.
do you get a little smile on your face when you see that patient out doing something and you think, that's wonderful?
It does.
Or that athlete back on the field after an injury.
No, yeah, definitely. And some people approach me if I don't recognize them, or they see me and I don't see them, and I'm always happy to see people doing well.
It sounds like you try to develop a great relationship with your patients.
I do. It's nothing that I'm doing intentionally. It's just a byproduct of actually caring, of really caring about the person across from me. And it just comes across. It's nothing that I am artificially doing. I genuinely care about the person in front of me, what their life is like, what situations they're in, and how I can help them. And sometimes it's listening, sometimes it's surgery, sometimes it's an injection of medication. We explore all these options. I'm not one of these guys that's in the room for 2 minutes and I've got an army of assistants and you never see me after surgery. And that's not it at all. I'm there, I'm available, and it's my mission is to help people. This is really a vocation for me, something I felt called to do from the beginning.
That's wonderful. What do you do to relax? What sort of hobbies do you have?
What What do I do? Exercise. I like to, stay in shape. I like being outside. This is another part of being in the Meadville, Titusville area. It's just a beautiful part of Pennsylvania. Love to be on the water and around water. Find that very soothing. Spend time with my wife, with my family and friends.
That's wonderful. And yeah, it's nice just to be able to step outside, walk around, and get some fresh air and
Definitely.
enjoy the scenery. Kelly, a lot is going on at the hospital, and you've been awfully busy. What's going on?
Yes, we are very busy. On top of bringing on Dr. Gates, we recently brought Meadville Obstetrics and Gynecology Associates on board. So they're here 1 day a week, seeing patients, which is really great. We've had a very, very positive impact on a lot of folks here, appointments close to home. We actually were just there. We went to their office, me and Luke, and got to meet them personally and did some filming, and they were a really great group. Got to know them a little bit. And so if anyone's looking for, to switch doctors, we now have them right here in Titusville. So they are a great group, so glad to bring them on board.
Well, I even tried to give our oldest back because Dr. Maxfield delivered our oldest. So I was like,
Yeah, no take-backs.
any returns on this? I mean, it's 19 years, but, still, the warranty had expired by that point.
Yeah.
You're watching the Morning Drill on Stream Television and on Armstrong's Neighborhood Channel and listening to it on the Allegheny News Talk Sports Network. Kelly, in terms of a need there, again, do they call the hospital here for those appointments?
Yes,
Okay.
you can call the hospital here, but actually they make appointments straight out of their Meadville office.
Okay.
So it's the 333-5888 number, and that will get you right in touch with them. Just let them know that you want to be seen in the Titusville office, and they will set you up with appointments. Like I said, they're here 1 day a week currently, based on the need. If we have a bigger need, they are willing to probably move into more days. But so right now, that's just really exciting to have them here. They are filling up. I think they're doing some surgeries already in the
wow.
hospital. So yeah, very exciting to have them here.
That's wonderful. Dr. Benjamin Shore.
Dr. Benjamin Shore, yes, he started this week. He is our new general surgeon at the hospital. He will be working with Dr. Rogers and our surgical team there. So, like, again, the need is there. Dr. Rogers was our only general surgeon, so it really just gives more access to these patients that, need surgical, and, and it kind of will allow Dr. Rogers to maybe take a little break. So he'll be working, like I said, alongside him, but he just started this week, so we're very excited to have him as well.
That's wonderful. And then you've got Crawford Gibbs coming up.
Crawford Gives, yes, it's 2 days, August 29th and 30th. Nonprofit organizations are kind of blasted and kind of get to tell their story of what they're raising their money for. And we are lucky to be a part of that. Our project is the oncology department. It is actually going to be moved from the first floor down to the ground floor. Giant renovation project. It's actually going to use an unused space, so there will be, it's actually a storage space now, so all of that will need to be renovated, new equipment. It's probably going to be a $5 million project. So we're going to start raising money now. It'll be similar to our ER renovation that took a long time and kind of a lot of money and dedication. So we are really, want to offer a better oncology department. I don't know if you've been to that wing of our hospital, but it's set in the older wing that has not been rehabbed yet. So to offer those patients that are coming in for oncology treatments, we really just want to give them easier access in and, a state-of-the-art facility, because we do have quite a few patients that come here. So
start
very
by
excited.
maybe contributing during
Yes.
Crawford Gibbs in a
Yes.
couple weeks.
So there'll be some email blasts. There'll be some things in the paper, on Facebook, social media. So yeah, look out for that. Anyone interested in giving to our oncology department? I know a lot of folks in this area hold it pretty dear to their hearts. We brought that on not that long ago, and it's the Yolanda J. Barco doctors that come over. Dr. Young comes over from Meadville, and he's amazing. He's great, and they have a really great team there.
That whole facility.
Taking care of our patients here. So
that's wonderful.
Yeah.
Dr. Gates, for you, before coming up here, did you look at the hospitals, and did that factor in any part of your decision? Just the investment back into the hospitals and into the community?
Oh yeah, definitely. It was great to see an independent health system that's not only surviving but thriving and serving the community well, making strategic investments like that. Definitely, I've learned to ask those questions because they're important ones, and I was very happy to see what's happening here.
And you're going to be working with a crew that has history behind it as well. I think just a year or two ago, or a couple years ago, they celebrated their 50th anniversary as a group, and I mean that's got to be exciting too to come into that.
Oh yeah, definitely an outstanding orthopedic group, great track record, great history. So very proud to be a partner there.
Do you find that the folks in Western Pennsylvania, Northwestern Pennsylvania, they tend to work hard and push themselves and maybe overdo it sometimes?
I do. I'm a.
It's who we are, right?
Exactly. And maybe I've got some bias because I'm from the area. But
Yeah.
no, certainly it's great people, hard working, down to earth, just want to get better.
You mentioned your family. Are they enjoying their time up here?
Yeah, they are. It's a beautiful part of Pennsylvania, and it's a place we knew growing up, and now I'm really happy to be here.
That's wonderful. So, Kelly, we want to make sure folks call Dr. Gates and get their appointments scheduled, so they can do that by contacting the hospital directly?
Yep, they can contact the hospital directly, ask for our orthopedic surgeon's office. They'll put you right in touch, get you an appointment, or you can call physician services directly. Again, that number 827-9770. And you'll get right in. Like I said, since we're just now launching this new practice, the appointments are available. But they won't be once they get to know Dr. Gates, I think.
Yeah, I agree.
Yeah.
And just thinking of the fall sports season that's coming up and how busy
Absolutely.
that group is in general. But to have somebody locally who can
Yes.
take care of a situation.
Yes, and has experience and dedication to the field. Yes, absolutely. It's going to be very nice to have him here.
Yeah. Dr. Gates, for you, when you're working with like a student athlete, for example, do you have those thoughts of when you played and how important it is to make sure that their situation is comfortable and that they're in good hands?
Yeah, definitely. I think the other thing I have too now is perspective. I remember when I was that age, it was your whole world. It was the only thing you wanted, and now I've got, a little more perspective, which I can share with them and sort of help them understand there's going to be a long life after this. Yeah.
That's great. And again, kids of all ages, right?
Yes.
Can be a customer and come in and schedule that appointment and get to meet Dr. Gates. So that's wonderful. Welcome to the community and welcome to Northwest Pennsylvania.
Well, thank you. Thanks for having me.
Best of luck with everything.
I appreciate
it. Kelly, for Crawford Gives, that's coming up August 29th through the 30th.
Yep. You can go. I'll have some things up on our Facebook page, on our website. There will also be on their website, Crawford Gives. I know they're doing quite a few advertisements. So, yes, you can go right on there. You can donate right online, or you can mail a check-in. If you do mail a check-in, you can do it ahead of time, so we can get it processed prior to. You can just send it to the Titusville Area Hospital Foundation, and we will gladly accept that.
That's wonderful. Now, will there be phases to this project, or is it just here's the overall thing and here's the cost?
The phases.
Okay.
Definite phases. Kind of like how we did the ER. It's a pretty big campaign, so it will last quite a while. We hope to get some grant money, things like that, just to get it moving along. But yeah, it's a big one.
All right, and you'll be at the Crawford County Fair next week?
We will. Well, there's Titusville Days on Monday, so we'll be set up there. And then actually, Orthopedic Associates in Meadville will be there in the MMC building on Tuesday.
Okay, so come by on Monday and say hi.
Come by on Monday and say hi. I'll be there.
Get a hot sausage sandwich.
Yeah, or gyro.
There you go.
I had a gyro last year. It was pretty good.
Dr. Gates, Kelly Clark, good to see you guys this morning. Thanks for your
Good to see you.
time.
Thanks,
Thank you,
Luke.
Luke.
All the best.